Question 1. A patient receiving vancomycin 4 develops flushing, pruritus, hypotension, and fever during infusion. The nurse should A. Stop the infusion and notify the prescriber immediately. B. Slow the infusion rate and monitor, continue the infusion. C. Give 4 epinephrine and continue the vancomycin. D. Administer diphenhydramine and continue at the same rate. Correct answer, A. Stop the infusion and notify the prescriber immediately. Rationale: these signs indicate red man syndrome or anaphylactoid reaction. Immediate cessation is required. After stopping, give antihistamine if ordered and restart slowly only after provider evaluation. Strategy: anytime an infusion causes systemic reaction, hypotension, flushing, stop infusion first, assess, and then notify provider. Question 2. A 68-year-old with creatinine clearance 25 ml per minute is ordered gentamicin. The nurse recognizes that gentamicin A. is safe at standard dosing without changes. B. requires dose reduction or extended interval dosing. C. should be switched to azithromycin because of renal impairment. D. needs to be given more frequently to avoid toxicity. Correct answer, B. requires dose reduction or extended interval dosing. Rationale: aminoglycosides are renally excreted and nephrotoxic. Dosing must be adjusted according to renal function, either lower dose or extended interval dosing with monitoring. Strategy: always check renal function and level monitoring, peaks/troughs, for aminoglycosides. Question 3. Linezolid is prescribed for VRE. Prior to administration, the nurse should inquire about A. recent use of a selective serotonin reuptake inhibitor, SSRI. B. allergy to beta-lactam antibiotics. C. alcohol consumption within 24 hours. D. use of insulin for diabetes. Correct answer, A. recent use of a selective serotonin reuptake inhibitor, SSRI. Rationale: linezolid is a weak MAOI and can precipitate serotonin syndrome if combined with SSRIs/SNRIs/MAOIs. Strategy: ask about all psychotropic medications and watch for signs of serotonin syndrome, agitation, hyperreflexia, fever. Question 4. A patient receiving daptomycin develops new-onset muscle pain and elevated creatine kinase (CK). The nurse interprets this as A. typical transient effect, no action. B. possible myopathy, hold dose and notify prescriber. C. allergic reaction requiring epinephrine. D. expected with daptomycin only at very high doses. Correct answer, B. possible myopathy, hold dose and notify prescriber. Rationale: daptomycin can cause myopathy and rhabdomyolysis. CK should be monitored and drug stopped if significant elevations or symptoms. Strategy: monitor muscle symptoms and CK regularly when on drugs associated with myopathy. Question 5. A client on high-dose 4-amphotericin B complains of chills and fever during infusion. The best nursing action is to A. slow the infusion rate and premedicate with acetaminophen and diphenhydramine per protocol. B. stop the infusion permanently. C. ignore, these are not related to amphotericin B. D. give 4-furosemide. Correct answer, A. slow the infusion rate and premedicate with acetaminophen and diphenhydramine per protocol. Rationale: amphotericin B often causes infusion-related fever/chills. Premedication and infusion rate adjustments are common nursing interventions. Stop only for severe reaction. Strategy: no common infusion-related side effects and facility pre-med protocols. Question 6. Which antibiotic most commonly causes Clostridioides difficile infection by disrupting normal gut flora? A. metronidazole. B. clindamycin. C. aztreonam. D. vancomycin, oral. Correct answer, B. clindamycin. Rationale: clindamycin strongly alters gut flora and is classically associated with C. difficile overgrowth. Oral vancomycin is a treatment for C. difficile. Strategy: associate clindamycin with high C. diff risk, monitor for diarrhea post-antibiotic. Question 7. A pregnant client, first trimester, needs antibiotic therapy for chlamydia. The best choice is A. doxycycline PO. B. azithromycin PO. C. ciprofloxacin PO. D. tetracycline PO. Correct answer, B. azithromycin PO. Rationale: azithromycin is safe in pregnancy for chlamydia. tetracyclines, doxycycline, tetracycline, and fluoroquinolones, ciprofloxacin, are contraindicated due to fetal risks. Strategy: always check pregnancy status and avoid tetracyclines/fluoroquinolones in pregnancy. Question 8. A patient on isoniazid, INH, complains of numbness and tingling in hands and feet. The nurse should A. Administer pyridoxine, vitamin B6, as ordered. B. Stop INH immediately, these are signs of permanent neuropathy. C. Ignore, this is unrelated to INH. D. Administer high-dose vitamin C. Correct answer: A. Administer pyridoxine, vitamin B6, as ordered. Rationale: INH causes peripheral neuropathy by B6 depletion, pyridoxine prevents/treats neuropathy. Strategy: monitor for neuropathy in patients on INH and give B6 prophylactically when indicated. Question 9. Which antibiotic requires monitoring of QT interval and should be used cautiously in patients on other QT prolonging drugs? A. Erythromycin. B. Piperacillin tazobactam. C. Gentamicin. D. Amoxicillin. Correct answer: A. Erythromycin. Rationale: macrolides, especially erythromycin, clarithromycin, can prolong QT and plus risk with other QT prolonging agents. Strategy: review med list for arrhythmogenic combinations and get baseline ECG when indicated. Question 10. A patient on trimethoprim sulfamethoxazole, TMP-SMX, shows hyperkalemia. The nurse recognizes that TMP-SMX can cause hyperkalemia by A. Inhibiting potassium excretion in the distal tubule. B. Increasing potassium absorption from the gut. C. Causing massive cell lysis. D. Binding potassium in the blood. Correct answer: A. Inhibiting potassium excretion in the distal tubule. Rationale: trimethoprim can act like a potassium-sparing diuretic, reducing renal potassium excretion. Strategy: monitor electrolytes, K+. When giving TMP-SMX. Question 11. A patient with Pseudomonas infection needs an aminoglycoside. Which pairing is synergistic and often used? A. Gentamicin plus ampicillin. B. Gentamicin plus piperacillin. C. Gentamicin plus ceftriaxone. D. Gentamicin monotherapy only. Correct answer: B. Gentamicin plus piperacillin. Rationale: aminoglycosides are synergistic with beta-lactams like piperacillin for Pseudomonas. Beta-lactam disrupts cell wall facilitating aminoglycoside entry. Strategy: recognize common synergistic combos, beta-lactam plus aminoglycoside, and monitor for additive toxicity. Question 12. A client on rifampin for tuberculosis notes orange discoloration of bodily fluids. The nurse should A. reassure that orange discoloration is expected and harmless. B. Stop rifampin, this is a sign of hemolysis. C. Report immediately, this indicates liver failure. D. Tell the patient to decrease the dose. Correct answer: A. Reassure that orange discoloration is expected and harmless. Rationale: rifampin commonly causes orange-red discoloration of urine, sweat, tears. It's harmless but can stain contact lenses. Strategy: counsel patients about expected harmless side effects to improve adherence. Question 13. A patient with a severe MRSA bloodstream infection is started on daptomycin. The nurse should remember not to use daptomycin for A. complicated skin infections. B. MRSA bacteremia. C. pneumonia. D. right-sided endocarditis. Correct answer: C. pneumonia. Rationale: daptomycin is inactivated by pulmonary surfactant and is ineffective for pneumonia. Strategy: no drug limitations by site, e.g., daptomycin poor for lungs. Question 14. A patient taking warfarin is started on metronidazole. The nurse should A. anticipate decreased INR and increased clotting risk. B. anticipate increased INR and increased bleeding risk. C. advise no change, metronidazole does not interact with warfarin. D. switch to heparin immediately. Correct answer: B. anticipate increased INR and increased bleeding risk. Rationale: metronidazole inhibits warfarin metabolism, increasing INR and bleeding risk. Strategy: monitor INR and watch for bleeding when antibiotics that interact with warfarin are started. Question 15. A neonate requires an antibiotic for suspected gram-negative sepsis. The nurse should be cautious using ceftriaxone because A. It causes kernicterus by displacing bilirubin from albumin in neonates. B. It is ineffective against gram-negative organisms. C. It causes irreversible renal failure in neonates. D. It is contraindicated due to causing neonatal sepsis. Correct answer: A. It causes kernicterus by displacing bilirubin from albumin in neonates. Rationale: ceftriaxone can displace bilirubin and should be avoided in neonates, ESP premature, due to risk of kernicterus. Strategy: check age-specific contraindications for antibiotics, especially in neonates. Question 16. A patient with severe hepatic impairment is prescribed erythromycin. The nurse recognizes a need for caution because erythromycin is A. Hepatically metabolized and may accumulate. B. Exclusively renally excreted, no issue. C. Inactivated by gastric acid. D. Safe at any hepatic level. Correct answer: A. Hepatically metabolized and may accumulate. Rationale: macrolides are metabolized by the liver. Hepatic impairment can increase levels and side effects. Strategy: adjust dosing and monitor for toxicity in hepatic dysfunction. Question 17. Which antibiotic is most associated with tendon rupture, especially in elderly patients or those on corticosteroids? A. Ciprofloxacin. B. Amoxicillin. C. Azithromycin. D. Nitrofurantoin. Correct answer: A. Ciprofloxacin. Rationale: fluoroquinolones, ciprofloxacin, have an association with tendinitis and tendon rupture, risk increased with age and corticosteroids. Strategy: advise patients to report tendon pain immediately and avoid strenuous activity. Question 18. A patient on prolonged high-dose cefepime develops new confusion and myoclonus. The nurse should suspect A. Cefepime-induced neurotoxicity, especially in renal failure. B. Allergic reaction, anaphylaxis. C. Stroke, call stroke team. D. Dehydration causing confusion. Correct answer: A. Cefepime-induced neurotoxicity, especially in renal failure. Rationale: cefepime can cause encephalopathy and seizures in renal impairment. Dose adjust according to renal function. Strategy: review renal dosing for cephalosporins and monitor neurosigns. Question 19. A patient with a urinary tract infection due to E. coli resistant to fluoroquinolones is prescribed fosfomycin. The nurse should advise that fosfomycin A. is given as a single-dose oral therapy for uncomplicated UTI. B. requires 7 to 10 days IV therapy only. C. is ineffective against E. coli. D. causes red man syndrome. Correct answer: A. is given as a single-dose oral therapy for uncomplicated UTI. Rationale: fosfomycin trometamol is often a single-dose oral treatment for uncomplicated cystitis due to susceptible organisms. Strategy: no unique dosing regimens for certain agents, single-dose fosfomycin. Question 20. A client with myasthenia gravis develops pneumonia. Which antibiotic class should be avoided because it may worsen muscle weakness? A. Aminoglycosides. B. Penicillins. C. Macrolides. D. Tetracyclines. Correct answer: A. Aminoglycosides. Rationale: aminoglycosides can impair neuromuscular transmission and exacerbate myasthenia gravis. Strategy: screen for neuromuscular disorders and avoid drugs that exacerbate them. Question 21. Which antibiotic acts by inhibiting bacterial DNA gyrase and topoisomerase 4? A. Ciprofloxacin. B. Doxycycline. C. Linezolid. D. Vancomycin. Correct answer: A. Ciprofloxacin. Rationale: fluoroquinolones inhibit DNA gyrase and topoisomerase 4, preventing DNA replication. Strategy: link mechanism to class to predict resistance and side effects. Question 22. A patient with severe sepsis is started on piperacillin-tazobactam. Which adverse effect should the nurse monitor for that is specifically associated with beta-lactam antibiotics? A. Seizures at high doses, especially in renal failure. B. Ototoxicity independent of renal function. C. QT prolongation. D. Hyperglycemia. Correct answer, A. Seizures at high doses, especially in renal failure. Rationale: high doses of some beta-lactams, ESP imipenem, also piperacillin in renal failure, can lower seizure threshold. Strategy: monitor neurostatus and adjust dosing with renal impairment. Question 23. A patient on nitrofurantoin complains of progressive dyspnea and cough after months of therapy. The nurse should suspect: A. Nitrofurantoin-induced pulmonary toxicity. B. Heart failure unrelated to medication. C. Asthma exacerbation only. D. Pulmonary embolism. Correct answer, A. Nitrofurantoin-induced pulmonary toxicity. Rationale: nitrofurantoin can cause acute or chronic pulmonary reactions, including interstitial pneumonitis and fibrosis with prolonged use. Strategy: educate about and monitor for pulmonary symptoms with long-term nitrofurantoin. Question 24. A patient taking chloramphenicol should be monitored for: A. Aplastic anemia and bone marrow suppression. B. QT prolongation. C. Ototoxicity. D. Hypoglycemia. Correct answer, A. Aplastic anemia and bone marrow suppression. Rationale: chloramphenicol can cause dose-related bone marrow suppression and idiosyncratic aplastic anemia. Strategy: monitor CBC for unexplained cytopenias in patients on chloramphenicol. Question 25. A patient with pseudomembranous colitis failing metronidazole therapy should be changed to: A. Oral vancomycin. B. Vancomycin. C. Oral ciprofloxacin. D. Oral doxycycline. Correct answer, A. Oral vancomycin. Rationale: oral vancomycin is the preferred treatment for C. difficile infections that fail or are severe, for vancomycin does not reach gut lumen. Strategy: remember route matters, oral vancomycin treats GI infections. Question 26. A client on prolonged sulfonamide therapy develops a widespread rash, fever, mucosal lesions, and elevated liver enzymes. The nurse should suspect: A. Stevens-Johnson syndrome/toxic epidermal necrolysis, SJS/10, and stop drug immediately. B. Normal drug rash, continue. C. Simple allergic rhinitis. D. Serum sickness. Correct answer, A. Stevens-Johnson syndrome/toxic epidermal necrolysis, SJS/10, and stop drug immediately. Rationale: sulfa drugs can cause severe mucocutaneous reactions, immediate discontinuation and urgent care are necessary. Strategy: recognize severe cutaneous adverse reactions and act immediately. Question 27. Which antibiotic penetrates the central nervous system well and is used for meningitis empirically in neonates? A. Cefotaxime or ceftriaxone, 3rd generation. B. Vancomycin only. C. Tetracycline. D. 1st generation cephalosporins. Correct answer, A. Cefotaxime or ceftriaxone, 3rd generation. Rationale: 3rd generation cephalosporins have good CSF penetration and are used for meningitis. Selection depends on age and organism. Strategy: know which drugs cross the BBB, 3rd gen cephalosporins, vancomycin, with inflammation. Question 28. Which antibiotic mechanism is associated with red man syndrome? A. Rapid infusion of vancomycin causing histamine release. B. Rapid infusion of amphotericin B. C. Serotonin syndrome from linezolid. D. Tetracycline photosensitivity. Correct answer, A. Rapid infusion of vancomycin causing histamine release. Rationale: red man syndrome is histamine-mediated infusion reaction seen with rapid vancomycin infusion. Strategy: infusion rate matters, slow vancomycin over at least 60 minutes, longer for higher doses. Question 29. A patient with a history of G6PD deficiency develops hemolysis after antibiotic therapy. Which agent is most likely responsible? A. Dapsone or sulfonamides, e.g., TMPSMX. B. Penicillin V. C. Erythromycin. D. Cefuroxime. Correct answer, A. Dapsone or sulfonamides, e.g., TMPSMX. Rationale: oxidative drugs like sulfonamides and dapsone can precipitate hemolysis in G6PD deficiency. Strategy: screen for G6PD history and avoid oxidant drugs. Question 30. Which antibiotic would be most appropriate for an infection caused by an extended-spectrum beta-lactamase, ESBL, producing organism? A. Carbapenem, e.g., meropenem. B. Amoxicillin clavulinate. C. Cefazolin. D. Erythromycin. Correct answer: A. Carbapenem, e.g., meropenem. Rationale: ESBL organisms are resistant to many cephalosporins and penicillins. Carbapenems are often the treatment of choice. Strategy: recognize ESBL resistance patterns and escalate to carbapenems when indicated. Question 31. A patient receiving high-dose trimethoprim for PCP prophylaxis complains of sore throat, fever, and easy bruising. The nurse should suspect: A. Bone marrow suppression, obtain CBC immediately. B. Viral pharyngitis, no action. C. Allergic reaction, administer epinephrine. D. Dehydration. Correct answer: A. Bone marrow suppression, obtain CBC immediately. Rationale: high-dose TMPSMX can cause bone marrow suppression, pancytopenia, monitor blood counts. Strategy: monitor CBC with agents known to suppress marrow. Question 32. An infant with Group B strep sepsis should receive: A. Penicillin G or ampicillin as first-line therapy. B. Doxycycline. C. TMPSMX. D. Ciprofloxacin. Correct answer: A. Penicillin G or ampicillin as first-line therapy. Rationale: penicillins are first-line for Group B streptococcus in neonates. Many other antibiotics are contraindicated or ineffective. Strategy: no pathogen drug first-line matches for critical neonatal infections. Question 33. Which antibiotic is contraindicated in children under 8 years due to permanent tooth discoloration and bone growth inhibition? A. Doxycycline, tetracyclines. B. Azithromycin. C. Amoxicillin. D. Cefdinir. Correct answer: A. Doxycycline, tetracyclines. Rationale: tetracyclines bind to calcium in developing teeth and bones, causing discoloration and growth issues. Strategy: avoid tetracyclines in young children unless benefit outweighs risk. Question 34. A patient on linezolid is noted to be hypertensive, sweating, and tachycardic after starting meperidine for pain. The nurse suspects: A. Serotonin syndrome or hypertensive crisis from MAOI interaction, treat urgently. B. Simple pain response, no change. C. Allergic reaction, give antihistamine. D. Drug ineffective, switch analgesic. Correct answer: A. Serotonin syndrome or hypertensive crisis from MAOI interaction, treat urgently. Rationale: linezolid can act as MAOI. Meperidine can precipitate severe reactions including serotonin syndrome or hypertensive crises with MAOI-like drugs. Strategy: avoid certain opioids and serotonergic meds with linezolid. Watch for neuromuscular and autonomic instability. Question 35. Which antibiotic requires monitoring of serum trough concentrations to minimize toxicity? A. Vancomycin and aminoglycosides, e.g., gentamicin. B. Azithromycin only. C. Amoxicillin only. D. Metronidazole only. Correct answer: A. Vancomycin and aminoglycosides, e.g., gentamicin. Rationale: these drugs have narrow therapeutic windows and require serum level monitoring, troughs and sometimes peaks. Strategy: know which agents require therapeutic drug monitoring, TDM. Question 36. A patient with a severe sulfa allergy needs PCP prophylaxis. Which alternative is appropriate? A. Atovaquone or pentamidine, aerosol. B. Continue TMPSMX regardless of allergy. C. Doxycycline daily. D. Ciprofloxacin. Correct answer: A. Atovaquone or pentamidine, aerosol. Rationale: for sulfa-allergic patients, alternatives include atovaquone, dapsone, with caution, or aerosolized pentamidine. Strategy: no alternatives for common prophylaxis regimens in allergic patients. Question 37. A patient on prolonged aminoglycoside therapy begins complaining of tinnitus and hearing loss. The nurse should A. Recognize aminoglycoside ototoxicity and notify provider, hold medication if ordered. B. Reassure that tinnitus is temporary and continue therapy. C. Switch to higher dose to overcome symptoms. D. Administer loop diuretic to relieve symptoms. Correct answer, A. Recognize aminoglycoside ototoxicity and notify provider, hold medication if ordered. Rationale: aminoglycosides cause irreversible ototoxicity, symptoms warrant immediate evaluation and often cessation to prevent progression. Strategy: monitor hearing and renal function, act immediately on ototoxicity signs. Question 38. A patient is started on ceftriaxone and warfarin. The nurse should expect which effect on coagulation? A. Ceftriaxone may increase bleeding risk by displacing warfarin, monitor INR. B. Ceftriaxone decreases warfarin effect, INR will drop. C. No interaction expected. D. Ceftriaxone inactivates warfarin, switch anticoagulant. Correct answer, A. Ceftriaxone may increase bleeding risk by displacing warfarin, monitor INR. Rationale: cephalosporins can potentiate warfarin effect, monitor INR when starting antibiotics. Strategy: always consider warfarin interactions with antibiotics. Question 39. Clarithromycin is added to a patient's regimen. The patient is also taking levastatin. The nurse should A. Anticipate increased statin levels and risk of rhabdomyolysis. B. Expect reduced statin effect, risk of thrombosis. C. No interaction, continue both. D. Switch levastatin to pravastatin without discussion. Correct answer, A. Anticipate increased statin levels and risk of rhabdomyolysis. Rationale: macrolides inhibit CYP3A4 and can increase levels of statins metabolized by this pathway, increasing rhabdomyolysis risk. Strategy: check CYP interactions and temporarily hold or switch statin if macrolide needed. Question 40. A hospitalized patient is prescribed oral linezolid for MRSA cellulitis. The nurse knows to instruct the patient to avoid A. Foods high in tyramine, e.g., aged cheese, cured meats. B. Dairy products only. C. Foods high in folate. D. Caffeine-containing beverages only. Correct answer, A. Foods high in tyramine, e.g., aged cheese, cured meats. Rationale: linezolid has MAOI activity, high tyramine foods can precipitate hypertensive crises. Strategy: educate about dietary restrictions while on MAOI-like agents. Question 41. Which antibiotic class is bacteriostatic by inhibiting protein synthesis at the 50S ribosomal subunit and can cause aplastic anemia, rare? A. Chloramphenicol. B. Aminoglycosides. C. Fluoroquinolones. D. Beta-lactams. Correct answer, A. Chloramphenicol. Rationale: chloramphenicol inhibits 50S and is mainly bacteriostatic, it can cause aplastic anemia. Strategy: remember rare but serious bone marrow effects of older agents. Question 42. A patient with severe hepatic cirrhosis is given rifampin. The nurse should monitor for A. Hepatotoxicity and elevated LFTs. B. Kidney stones. C. Ototoxicity. D. Pulmonary edema. Correct answer, A. Hepatotoxicity and elevated LFTs. Rationale: rifampin can be hepatotoxic, monitor LFTs, especially in hepatic disease. Strategy: baseline and periodic LFTs for hepatotoxic antibiotics. Question 43. A patient with recurrent UTIs is prescribed nitrofurantoin. Which prerequisite must be met for nitrofurantoin to be effective? A. Adequate renal function, creatinine clearance 30-60 ml/min depending on guidelines. B. Hepatic impairment. C. Concurrent use of antacids. D. High protein diet. Correct answer, A. Adequate renal function, creatinine clearance 30-60 ml/min depending on guidelines. Rationale: nitrofurantoin concentrates in urine and is less effective/contraindicated with low CrCl. Strategy: check renal function prior to starting nitrofurantoin. Question 44. A patient with MRSA pneumonia is prescribed ceftaroline. The nurse should recognize ceftaroline's advantage. A. It's a cephalosporin with activity against MRSA by binding altered PBPs. B. It's a macrolide effective for MRSA. C. It's a fluoroquinolone active against MRSA. D. It's ineffective against MRSA. Correct answer: A. It's a cephalosporin with activity against MRSA by binding altered PBPs. Rationale: ceftaroline is a fifth-generation cephalosporin with MRSA activity via PBP2A binding. Strategy: remember newer cephalosporins' expanded spectra, ceftaroline. Question 45. A patient on ketogenic diet is started on antibiotics for infection. Which antibiotic can lower seizure threshold and must be used cautiously? A. Imipenem, a carbapenem. B. Amoxicillin. C. Erythromycin. D. Vancomycin. Correct answer: A. Imipenem, a carbapenem. Rationale: carbapenems like imipenem lower seizure threshold, caution in patients at risk for seizures. Strategy: review seizure risk with certain antibiotics, carbapenems, fluoroquinolones. Question 46. A patient with severe hepatic dysfunction is ordered daptomycin. The nurse notes daptomycin is primarily A. Cleared renally, monitor renal function. B. Highly hepatically metabolized, avoid. C. Excreted via lungs. D. Inactivated by bile. Correct answer: A. Cleared renally, monitor renal function. Rationale: daptomycin is primarily renally excreted, adjust dosing in renal impairment. Strategy: check excretion pathways, renal versus hepatic, to guide dose adjustments. Question 47. Which antibiotic is commonly used for anaerobic infections and is associated with metallic taste and disulfiram-like reactions with alcohol? A. Metronidazole. B. Ciprofloxacin. C. Azithromycin. D. Amoxicillin. Correct answer: A. Metronidazole. Rationale: metronidazole is used for anaerobes, protozoa, and causes metallic taste and disulfiram-like reaction with alcohol. Strategy: counsel patients to avoid alcohol during and 48 to 72 hours after therapy. Question 48. A patient on long-term tetracycline develops photosensitivity. The nurse will include which instruction? A. Avoid prolonged sun exposure and use sunscreen and protective clothing. B. Continue usual sun exposure, photosensitivity is mild. C. Photosensitivity means drug allergy, stop immediately. D. Take vitamin D to prevent photosensitivity. Correct answer: A. Avoid prolonged sun exposure and use sunscreen and protective clothing. Rationale: tetracyclines cause photosensitivity, patients should avoid sun exposure and use protection. Strategy: educate about photosensitizing medications and protective measures. Question 49. Which antibiotic is first line for Lyme disease in adults and adolescents but generally avoided in young children and pregnant women? A. Doxycycline. B. Amoxicillin clavulinate. C. Azithromycin. D. Cefuroxime. Correct answer: A. Doxycycline. Rationale: doxycycline is first line for early Lyme disease but avoided in children 8 and pregnant women due to tooth/bone effects. Alternatives include amoxicillin or cefuroxime. Strategy: choose age and pregnancy appropriate agents for common infections. Question 50. A hospitalized patient on piperacillin tazobactam and vancomycin develops acute kidney injury, AKI. Which consideration is most relevant regarding vancomycin dosing? A. Vancomycin dosing must be adjusted and levels monitored, accumulation risk with AKI. B. Continue same vancomycin dose, kidney function does not matter. C. Stop vancomycin and replace with linezolid without discussion. D. Vancomycin is hepatically cleared, no adjustment. Correct answer: A. Vancomycin dosing must be adjusted and levels monitored, accumulation risk with AKI. Rationale: vancomycin is renally excreted, AKI increases risk of accumulation and nephrotoxicity, monitor troughs/AUC and adjust dosing. Strategy: always reassess dosing with changes in renal function and obtain serum levels as indicated. If you made it to the end, you're already ahead of most nursing students. Remember, antibiotics are not just medications, they're lifesavers, and nurses must know them inside and out. Keep studying smart, stay consistent, and never lose sight of your NCLEX goal. Don't forget to hit like, subscribe, and share this video with another nursing warrior. Until next time, keep pushing, keep believing, and keep getting NCLEX made easy 91.